for me to come here today. I've been in Edinburgh before for your wonderful festival. I think it was about 2 years ago. And the highlight of my musical going to concert life was Judy Foyle's live here in the city. It's a beautiful place, and it's good to be back, even though it's a very different city to the city I visited during the Edinburgh Festival a very short while ago. The heads are down, the muzzles are on, people are frightened, the shops are closed. Never mind the shops, the bloody bars are closed. Your lovely smoky whiskey. So yeah, it's a different time. So I work as a GP. I've worked in Derry. I qualified in 1981. I've worked for the NHS since, and for the mathematicians among you, that's a very big number. And I work as a GP in my hometown of Derry, and I took early retirement for my sins to go into politics, and that didn't go so well. So I was laughing at the first speaker talking about the twin evils of the medical profession and politicians. Sorry, I ticked both these boxes, but I resigned because I did say that if they locked my hometown of Derry down again because of positive PCR tests, because of the lie of positive PCR tests, that I would resign my council seat and I wouldn't have any hand-acted part in a government that abused and lied and inflicted harm upon their people.
Well done, Paul. Well done.
So, I feel so sorry because I'm kind of half dry here and you people getting wet, but anyway, I'll try and not bore you too much. So I worked for the NHS, and I've seen during my professional life the decimation of that organisation by cutbacks and privatisation, by slicing it off. So that whenever this, whatever it was, hit back at the beginning of last year, the NHS was in a very powerless state. And we know that compared to other developed countries, even in Europe, for example, Germany has 5 times the number of beds per head of population, including intensive care provision, than we have here. So that, you know, the NHS was not capable of mounting a response. And then we saw the nursing home scandal. And again, this happened in lockstep all over Europe, where ill, frail, elderly people who were in hospitals, which their taxes have paid for throughout their lives, expecting to be treated for medical problems, were taken from their beds and put into the care home sector without proper medical supervision. The expectation was that they were not going to receive further medical help should the conditions deteriorate. And genocide is what happened, and we need a public inquiry, and like the previous speaker said, people must be held to account. So then we had the pretext for locking us up. Now, the World Health Organization published pandemic guidelines as recently as October 2019. They did not mention, the word lockup wasn't mentioned in any of this, and yet we have the modelling of Professor Neil Ferguson, who, as far as I know, in his professional career, hasn't got anything right yet. So obviously the government turned to him for looking for some context for this. He assumed in a population 100% susceptibility. None of us have any immune systems. He assumed that the immune system was a conspiracy theory, and that cross-immunity from other previous infections, especially coronaviruses, couldn't be a factor. And he was modelling infectivity and spread without knowing the denominator. And we still hear people talking about R-naughts, like as if they knew something. We cannot make these calculations without having hard data, and we still, almost a year into this, don't know how many people have been infected with this virus. And early on we knew about the Diamond Princess, this petri dish of frail elderly people, where there were almost 4,000 people in that boat. And yet only 700 were infected, so that we knew that these people were not susceptible. Very early on, well, mic up now. Very early on, I'm going to need somebody to hold that. We knew that I mean, there was a paper published in the British Medical Journal, which actually is one of the medical publications that has done pretty well throughout all this, and it showed as early as June that we knew that probably 2 out of 3 of the excess deaths, which we certainly saw happening in April, but 2 out of 3 of them were caused not by any virus, but by the non-availability of the NHS, by the lock-up itself, and you know and then came to me what was a really sinister development was the fact that we changed the rules around death certification, so that there was no continuity with the past. There was nothing that this disease was a new thing, and we were measuring it in a different way to we had ever measured disease before, so that the knowledge that the medical community had about how diseases behave was null and void, and we were sort of starting from a clean sheet. And this year that's even more compounded by the fact that we no longer count flu and other seasonal respiratory viruses and pneumonias as separate entities. It's all coming under one umbrella. So this is nuts. And in April, I think it's really, really important, because I've said this before and people say, you know, this isn't true. As recently as the 18th of November, every doctor in the north of Ireland, and I'm sure again it's the same here in Scotland, got a letter from our august Chief Medical Officer. And it said it in April, we changed how we did it. I'm going to read it out to you. On the occasions where there is no confirmed COVID-19 diagnosis, the medical practitioner shall apply their clinical judgment whether the disease caused, is assumed to have caused or contributed to the death. And if so, the terms COVID-19 or COVID-19 probable or suspected are acceptable. And across Europe and across the world, we had this massive, but even without testing, that this was attributed as a cause of death. And as I say, we were reminded that this is still reasonable. And we know that when the figures were re-examined right across the globe, for example the CDC in America, the people who were attributed as COVID deaths, when they looked at the numbers again, it was only 6% of their total. In the Republic of Ireland there was 1,800 attributed deaths, which again, when they looked at it closely, less than 100 were actually due to this agent.
Unbelievable. Unbelievable.
It is unbelievable. I love rain. It's also very, very important that you realise that there is nothing unusual going on in the hospitals right across the UK at this time of the year. We're always bloody busy at this time of the year, and they're busier again because we've missed 29 million GP appointments. Whenever I was working in the health centre, and I have been back there doing locums, the surgery was like bedlam. It was like something in sub-Saharan Africa every day of the week. We were seeing maybe 60 patients a day, and of those, possibly maybe 5 would have needed, a face-to-face assessment, and we prevented people having to go to hospital. So now, when none of that is happening, it's small wonder that the accident and emergency departments are queued out the door. So there are excess deaths happening, but the vast majority. Not the vast majority, but the bulk of the excess deaths are happening not in hospitals but in people's own homes, and they're happening in a younger demographic, because this lockup is preventing people accessing the medical help that they need. Young people are dying needlessly of heart disease, of strokes, of bleeds. We have no cancer screening going on. We have all of the stuff that the NHS does has been sidelined, and people with chronic diseases and the chronic inflammatory processes are more or less just being left to get on with it, and it's scandalous. And we know that it is anticipated that there may be 200,000 excess deaths arising from the non-availability of cancer screening and from late diagnoses and from people dying from all of these myriad of other causes that take us from this life. So I'm going to frighten you now, because I'm going to get started now. So I want to talk to you really about 3 things, and the first one is about the PCR test. It's been touched on here briefly today. These tests, which are driving public policy and which are giving cover to our craven politicians, are not fit for purpose. So I want to talk about them. I want to talk about the myth of asymptomatic transmission, and I want to talk about the efficacy of lockdowns. As we know, the people are being terrified by these polymerase chain reaction tests. And again, this is the pretext for why we're all in lockdown. This case study and testing. And again, the World Health Organization pandemic guidelines did not mention testing and tracing, and we know that once any infectious agent is spread throughout a community, as this seems to have been, that testing and tracing is the entire bulk of the healthy population is an exercise in futility. If we wrapped ourselves in cotton wool and hid under our beds and stayed there for 6 months or 6 years and came out, this virus might still be here and we would still be susceptible. So the only way since the dawn of time that humans have managed to protect themselves from disease is to come in contact with it. And unfortunately, the elderly and the susceptible, as it always happens, are likely are more likely to succumb. Horace Mullis, the man who invented the PCR test, he got a Nobel Prize for doing so. And he said, he was adamant, he said it is not a diagnostic test, he said it's not even a test, it's a process. And we know that in these privately owned laboratories run by Serco and all the other government friends, that they're amplifying these things up to 45 cycles. You get this exponential increase of a very small piece of RNA. And we know that this is the government and SAGE know that this is a lie. They know that these tests are hugely false positive. And even where you have a specificity, as seems to be in this case, of somewhere between 96% and 99.2%. So let's go for the smaller figure. And let's say there's only 0.8% false positives. In the pillar 2, in the communities where there is only a tiny true percentage of people carrying this virus, then your positives, if you like, are soaked up by that false positive. So that we something like 80 or 90% of the positives which are being used to drive this narrative are in fact false positives. And we know that this identifies bits of virus, dead viruses, other coronaviruses, previous infections. It needs to stop. And we see that in Portugal, actually, the Court of Appeal in Portugal have said that these PCR tests cannot be used to drive public policy and that they cannot be used to deprive people of their freedom. So every single person here needs to write to your beloved leader and tell her that this is illegal and that it is an abuse of power.
Here we go.
And Ricky and Boris Johnson and all the SAGE people and Patrick Vallance and all of these corrupt I'm trying to choose my words carefully. This gentleman just provided the word criminal, and I think it's probably very appropriate. They know this, and they're wedded to lying to us about these ridiculous computer models and catastrophic Dublin rates. And if you extrapolate it from what they were saying at the time they imposed the second lockdown, the entire nation would be dead by Christmas. If you look at the outcomes of what they were saying. And the other thing is, I personally believe that because they knew the cases were already falling, even the lying PCR cases, they're already falling when they brought in the second lockdown. Do you remember all the panic? And there was a media link that it had to be done and it was announced at Halloween and it really had to be done quickly. Because they bloody knew that this thing was over. And they brought in the lockdown to pretend that the drop in cases was due to depriving people of their liberties and their freedom. So again, a very quick, and I realise that it's putrid weather and I'm quite comfortable here. You're welcome to cozy up if you want. I don't do the 2 metre bit. I think it's really important to talk about asymptomatic transmission because this has completely been debunked by a study from, would you believe, Wuhan, where they looked at 10 million people. The Chinese don't do piddling about with 40 or 50 people. They looked at 10 million people. They checked, they screened them 5 to 8 weeks after their lockdown, which ended, I think, on the 8th of April, and there was 92.8% participation. And every man, woman and child over the age of 6 was included, over 6. In June, in Wuhan, there were no symptomatic cases. There were 300 asymptomatic positive tests out of 10 million people. And then they looked, because the Chinese are good at this, they looked at 1,174 family members and close associates associates of those 300 asymptomatic positive tests, and they tested all them and they got not one single positive test. Asymptomatic transmission is a lie. It's over. It's over. And I'm looking at some of the lovely children here today. I really hope they have their thermal to wear off. Children don't get this or transmit it. And so why are we destroying their education? Why are we destroying their young lives? Why are we looking at them through masks and muzzles? Why are we frightening them? This is I saw somebody with a placard about crimes against humanity. This is a crime against humanity. Somebody doesn't want me to talk. There are now, the third thing is the efficacy of lockdowns. There are now 22 and rising every day peer-reviewed, published papers showing that lockdowns make no difference whatsoever right across the world, irrespective of the severity of the lockdown, whether it started early, whether it started late, whether it was imposed by the police, whether it was left to be, made no difference when you correct for seasonality and other demographic factors. Lockdowns make no difference. And how could they? This is ridiculous. We cannot hide. We cannot hide from a virus. It's simply not possible. Belgium, with the strictest lockdown in Europe, had the worst mortality per million population. Sweden, the control group for Europe, did pretty much the same as everywhere else. And it's now evident that countries that locked up are actually having more mortality. And here in these islands, we wasted the summer when this could have been spread among our young people and building up community immunity, endemic immunity. There are 80 plus peer-reviewed published papers showing the harms that lockdowns have done. So we have papers showing that they're useless, and at least 80 papers showing the harm they are doing. And this is before we know the figures around suicidality, around domestic violence, around child abuse, around the psychological harms which this is doing to our wonderful people. It would be impossible not to talk about vaccines. I think my prompter will disintegrate shortly. You'll be glad to hear, so I'm going to have to stop. So there's a man called Abbasi, an editor in the British Medical Journal on the 21st of November. And this is what he said. And this obviously has been confirmed by many researchers and independent journalists. And this is what he said, and this is important. When good science is suppressed by the medical political complex, people die. COVID-19 has unleashed state corruption on a grand scale. Politicians and industry are responsible for opportunistic embezzlement. So too are scientists and health experts. So SAGE knows this. There are 50 members of SAGE, we don't know who they are. They aren't publicising the evidence upon which they're basing their diktats. We see that Public Health in England did reports around procurement, and the authors were prevented from talking to the media. We've seen that these antibody tests, which the context the government awarded to their cronies, weren't fit for purpose. They were done without due scrutiny. They spent 75 million of your money, not their money, your bloody money, on a test that didn't work. So this boy Abbasi said, the pandemic response relies too heavily on scientists and government appointees with worrying competing interests, including shareholding in companies that manufacture diagnostic tests, treatments and vaccines. And government appointees can ignore or cherry-pick the science and indulge in anti-competitive practices that favour their own products and those of their friends and associates. So welcome to Democracy 2020. And in Ireland we have the same problem. The doctors, who are the media darlings, are used in prime-time television and radio. They use the children's toy show, our kind of flagship Christmas toy show, to peddle their filthy produce. They're just salespeople. And of course those of us who question this are called anti-vaxxers and conspiracy theorists. And we need a public inquiry, and we need good people to hold their politicians to account, keep asking them the questions, stop them in the streets, write to them. This has to end. Um, the other thing I wanted to talk to you about then, of course, is this vaccination. So why do we need to vaccinate a global population for a condition which is a mortality of 0.02%, overwhelmingly among people who are very elderly and very frail? Some of these vaccines are talking about giving them to 7 billion people. They need to be stored at minus 80 degrees. Do they not understand that there are millions of people in the world who don't have electricity? Women are dying prematurely, their children are dying prematurely because they have to cook over open fires. They don't have the basics that they require. They don't have clean water, they don't have sanitary facilities. And they're talking about giving them a vaccine that has to be stored at minus 80 degrees. There are 2 things a vaccine should do. It should prevent illness and death, and it should prevent transmission. And yet none of the tests underway are designed to look at these 2 parameters. They're still on talking about positive PCR tests as an event, and preventing a positive PCR test is in some way a measure of success. And coronavirus vaccines have a very poor safety record. There's no vaccine yet for SARS or MERS, and there are things which these current trials are not and have not addressed. We know that we can have disease enhancement due to pathogenic priming and catastrophic immune reactions. And what is hitting the media now more recently is these cross-reactivity, the spike proteins, which are the coating around the virus. They cross-react with other useful body proteins, particularly the human placental protein syntactin 1, meaning that the risk of infertility, in human females is very, very real. And I would beseech any people of childbearing age to refuse to accept this vaccine until we know in long-term studies that it's not a sterilant. The messenger RNA vaccines are using absolutely new technology. And again, there is no hurry here. This disease kills approximately 1 every 500,000 people on the face of the earth. There is no urgency around this whatsoever. And yet we are told that these things are going to be given to our people within the next few weeks, completely on trial. So you'll be glad to hear it has disintegrated. I'm going to have to shut up. I want to talk about censorship very briefly. I'm a doctor. I was a politician. And I am proud to be censored along with some of the most eminent, courageous professors, scientists and data analysts and thinkers right across the world. These are professors from Stanford, from Harvard, from Oxford, and fact checkers are telling them to shut up. We have entire battalions of the British Army, the 77th Brigade, the 13th Signals. We have a ream of state apparatus which will not allow us to speak. And that's why we have to stand here in the piston ring, because we can't do it anywhere else. So we've got to do this. The censorship, somebody sent me a meme the other day and it cheered me up no end. It was wonderful. It said, Facebook fact checkers at work, and there were 3 monkeys studiously grooming one another's nether regions. I changed my profile page to it because I just thought it was wonderful. So, yeah, it takes courage. I know many of you, certainly for me, this has cost me relationships with my family, with my friends, with my professional colleagues. But once I know that something is not true, then there's something inside me that just tells me that you've got to put it out there. And unless good people object to this tyranny, which we've heard about earlier on, these people are going to get away with it. So there's a national emergency on here. So look, get writing. Don't be afraid. The law. Oh yeah, I was going to finish actually with a bit of Scots Gaelic, because I go to Ireland Youth every year as well for your British Cultural Festival, and there we talk about Irish Shaffing in Aiken and Einsturness. We need to stand up against oppression. The law belongs to us, and our human rights are inviolable, and we need to take them back. you can go home now.